Welcome back. Once you've submitted your case, CureID moderators will be alerted and will review it to ensure it meets the guidelines and that no personally identifiable information has been accidentally included. On rare occasions, CureID moderators may reach out to you from curesupport@nih.gov if they have any clarifying questions about your case. Once your case has been approved, you'll be able to see it in Explore under the Rare Genetic Disorders and Risopathies case reports with your specific risopathy condition, along with all of those cases submitted by other patients, care partners, and clinicians. Click Explore to begin to see all of the cases that have been contributed to CureID. Select Rare Genetic Disorders as the category of interest and choose risopathies or type in the particular disease name of your specific condition. You would then select one of the applicable disease cards of interest to see the information. However, since we're just launching the Rare Genetic Disorders case report forms, we don't yet have data in these forms. So I will demonstrate how to view the information with an infectious disease example instead. So here I will search for an infectious disease called Balamuthia and select that disease card. I can see that there are 35 cases that have been reported for Balamuthia, and by selecting that, can then see all of the case reports that meet that criteria. Here you see the top 10 frequently reported drugs across all cases, and you can filter to see particular cases of interest, either by narrowing it to those where a particular drug was used, those that are just submitted by patients or clinicians or have been extracted from the published literature, as well as a variety of other characteristics. To see the full details of the case report, I can choose to select the case report and view all of the information just as it was submitted by the person entering the case report form. Thank you so much for your interest in CureID, and we hope that this information will be useful to you. Now that you've seen all of the cases aggregated together, as well as the detailed data collected through our case report form, we hope that you can see the value in CureID and the power of each individual sharing their treatment experience on the platform. Your experience may help another patient who's struggling to find effective treatments for their rare genetic disorder, and in turn, the data collected from others may help you. We believe that by collecting this treatment information in a systematic way and then making all of the data openly available to the community to explore, this will help to identify treatments that look promising, as well as those that do not. We're engaging with clinical trialists to share this information and hope that those treatments that appear promising can be prioritized for inclusion in randomized controlled trials where possible. By sharing your treatment experience in a structured way in this open access community, it brings us one step closer to identifying treatments that may help patients suffering from rare genetic disorders today while we wait for novel treatments. So once again, thank you for sharing your treatment experience and for being a part of the CureID community and the search for effective treatments for rare genetic disorder patients.